We're broadcasting today from Ottawa, which is the traditional unceded territory of the Algonquin and Anishinaabe people, and recognize that people right from coast to coast to coast have joined us and reflect the spirit and the rich cultures of healing and health from many, many different First Nations, Inuit, and Métis traditions. Thank you for joining us today, and please feel free to introduce yourself in the chat box as part of the webinar. And we'll get started. So one other thing, just logistically, that I should say as we get going. Si vous voulez écouter aujourd'hui en français, l'information pour joindre l'appel en français est dans le box audio. So if you have any questions, si vous avez des questions, n'hésitez pas de les écrire dans le chat box et nous allons vous aider. So welcome again. And let's get started. We have a wonderful panel with us today for this topic that is always important in all of our lives, but is particularly salient now. My name is Jennifer Zalmer. I'm the President and CEO of the Canadian Foundation for Healthcare Improvement. And it's my great pleasure first to turn things over to my co-host to introduce yourself. Claire, do you want to jump in?
Good afternoon, everyone. It's a great pleasure to co-host today's webinar on advanced care planning and serious illness conversations. I'm here as a patient partner. I was diagnosed with an incurable form of cancer relatively recently, and so I'm living with that, and so these conversations are really very meaningful to me. And I'll also be introducing our expert panel who will share their experiences of implementing programs to ensure that we address these conversations early. They are much needed. But as you listen to their experiences and learn about the approaches and tools that they use to successfully implement these programs nationally, provincially, and regionally, I encourage you all to think about the opportunities for what can be adopted in your own practice environment and in your own lives. In being diagnosed and sort of going through my own journey of advanced care planning, living with cancer, I had absolutely no idea when I agreed to co-host today's event that these issues would be so immediately relevant in my life. And so I'm going to share two very personal stories to really illustrate what advanced care planning and serious illness conversations are. About 2 weeks ago, one of my most loved uncles became very ill. And as a nurse, I know that he is in liver failure and he's failing quite quickly. And although he's in his early 80s, he's always been incredibly healthy. He exercises, he doesn't drink, he doesn't smoke. And so in his mind, there's been no reason to think or even to talk about the type of care that he would like when he can no longer speak for himself. And yet with this really rapid and distressing deterioration in his health, and as we await the results of his CT scan, he's in a crisis, and so are we. But we're also really deeply divided. Half of the family is trying to desperately open these conversations up with him, and the other half is desperately trying to close them down. Remain positive. Don't scare him. Stop talking about these things. So needless to say, it's been an incredibly confusing and difficult time. And in terms of his care, we know what he doesn't want. He refused to go to the emergency room this weekend for fear of COVID. But we have absolutely no idea of what it is he does want. And he's hoping his doctor will give him the answers tomorrow. And he's not alone in thinking like that. So what does it take for us to open up these conversations earlier? And we can see from Dr. Sunita Puri, who's Director of Palliative Medicine at the University of California, that COVID has brought into sharp focus the need for people of all ages and all states of illness or health to actually think these things through. So these challenging times are actually presenting a unique opportunity as well. And here's where I come to my second story. In another strange twist of fate, but a twist of fate that many are facing at this time, on Thursday of last week, my partner volunteered for redeployment to work in one of the nursing homes in Ottawa most hit by COVID. Tens of deaths, with some staff also have died. And you would think that as healthcare professionals that we would know better. I've gone through my own journey in advanced care planning and serious illness conversations. But I think with the focus around my cancer diagnosis and treatment decisions, all discussions focused on me, and because she was healthy, we forgot about those conversations. So it's redeployment yesterday, working on the front line, dealing directly with residents and people with COVID, impacted directly by COVID. Advanced care planning suddenly became an imperative, and it forced the conversation again in our household about what would happen if she became sick. And we needed to reflect not just on those medical decisions, would it, did she want to be ventilated or not, but what were the really important things, the things that really matter? What was the focus on the quality of life, not just an extension of life? And how could I honor those wishes if they don't fit with what I would choose? So very, very important conversations. And in fact, one of the key measures of quality when we look at the quality of these conversations is that, and the outcomes of these conversations, is that the person's expressed wishes for care are respected. And that's why it's important to have these conversations and to document them. Other measures include ensuring that everyone is working together to communicate and plan and set goals of care and support those informed decisions, decisions that can be changed over time, and ensure that those conversations and those connections are made in such a way that are individually and culturally respectful and that they're safe conversations. But to do this, we know that providers need the education, the skills, and the support. We also know that healthcare provider attitudes are incredibly important in facilitating these conversations, and that 8 in 10 Canadians have given end-of-life care some thought, but less than 1 in 5 actually have an advanced care plan. So most Canadians report thinking that it's important to talk to a family member or healthcare provider about care near the end of their lives, yet very few actually do. And of those that have, 36% of Canadians say they've talked to family about their future care, but 21% haven't talked to anyone. And I have to say, I think my uncle is in this group. And as is the case for my uncle, the most common reason for not having had the conversation about end-of-life care preferences was the belief that healthy people just don't need to do it. But there are also other reasons. And a 2018 study identified 5 themes that prevented advanced care planning. Public engagement is one of them, and that's why this webinar and the work that our experts are doing is incredibly important. And healthcare provider attitudes. We also need to create capacity in primary care and make sure that we're integrating these discussions into workflows and into health system and policy support. So decision-making happens along a continuum. The ideal time, of course, is to begin those discussions at the time when we're healthy and at home, and we have the time to reflect on our values and on our wishes. And when we're able to let those who care for us and love us know what kind of health and personal care we want in the future when we're not able to speak to themselves. And this process can be revisited, can be started at any time and revisited, but it does become more focused as health status changes. And so we see that, you know, often those conversations are forced upon us when we face serious illness or when we're faced with, you know, particular treatment decisions for ourselves or for the ones that we love. So without further ado, I would like to introduce our 3 experts. We're so lucky to have them here today. And I'd like them to each introduce themselves. And we will start with Louise and then move to Elizabeth and Nadine. So Louise, if you wouldn't mind giving us a little bit of background.
Thanks so much, Claire, for your introduction and for your important words that really drive home to us the personal experiences that so many people in our country are having right now. I'm a volunteer with Compassionate Ottawa. I'm a board member, and I'm also a facilitator of advanced care planning across our city. And Compassionate Ottawa is very much a community-based movement that's working towards building the capacity of our citizens in Ottawa so that they'll be more confident and more capable to help themselves, to help other people, family members, friends, to live well and to die and grieve well. We're very much community-based. We were started almost 3 years ago by a group of concerned Ottawa citizens who managed to bring together dozens of representatives of organizations across the city to focus on looking at whether or not Ottawa could become and wanted to become a compassionate community. So the work that we do, we aim to change attitudes and behaviors about death and dying. So we encourage people to think about their values, wishes, and beliefs and express them and think about their wishes for future care and care at the end of their lives. We do that by educating people, supporting them, empowering people in our diverse communities across our city. And most importantly, we do this work by engaging with our community partners so that we can increase the impact of our collective work, so that we know that that working together will have a much greater impact. And one of our major partners is the Champlain Hospice Palliative Care Program, and I'm delighted that Nadine is here to share this discussion with us. So we were asked to address a few questions, and the first was to tell you the approach we've taken here at Compassionate Ottawa to improve advanced care planning. So what's the gap we're trying to close? Well, we heard that Claire told us what the stats are. We knew that. Most people think this is important, but they're not doing it, and they're not talking to their loved ones, and they're not thinking through their wishes. So we wanted to change that. We wanted to close that gap, but we also wanted to help people understand what was meant by advanced care planning, because we know that there's lots of confusion, and we take a lot of our information and our lead from Speak Up Ontario and the work that's being done provincially, and as well the work that's been done by Nadine's organization. So we're trying to help people to understand that they need to identify and know who their substitute decision maker is, and make sure they're comfortable with that, and then have conversations with that person about their values, wishes, and beliefs for future care. And in terms of who we work with, our mission statement is clear, and one of our aims is to develop partnerships across our city. So as I said, we work with the Champlain Hospice Palliative Care Program. We work with other community organizations, community associations, community groups. We work with other NGOs, organizations such as CARP, the Council on Aging. We work with local business. We work with the municipal government, Ottawa Public Health. We work with school boards and schools. We work with faith communities. We work with workplaces across the city. We work with healthcare organizations such as community health centers and the Ottawa Hospital, and we work with academics, with Carleton University and with Ottawa University. So in terms of increasing awareness and supporting people to build confidence and capacity in advanced care planning, we've done a number of things. First of all, we needed to recruit and support, train, if you will, facilitators that could actually do this work. And we're lucky in Ottawa, we've got some really incredible people that have stepped forward and said that they want to be volunteers. They bring incredible experience in the community, working with community groups, working across sectors. So we've been very lucky with that. So we rely heavily on the Champlain Hospice Palliative Care Program for help with training our volunteers so that they have the capacity to go out to the community. And what we've been doing is community workshops. So we've been going out and meeting with groups of people, small groups. We purposely keep them small, 20 to 25 people, and we have advanced care planning workshops. The prime focus of our workshops has been conversations. So what kinds of things do you think about in terms of reflecting on your values, wishes, and beliefs? And then how do you have that conversation with the important people in your lives? And secondly, we stress the importance of making sure that your substitute decision maker, you know who that is, you have someone that you're comfortable with that will respect your wishes if you can't speak for yourself, and that you have the conversation with that person and other people. Through these community workshops and other venues, we distribute resources to the community. So the Speak Up Ontario workbook, Champlain Palliative Care has developed some resource lists. So we have a number of resources that we share with people. And we outreach to our community partners. So we find ways that we can work effectively with all of our partners. And for example, just before the COVID restrictions came upon us, we were working quite closely with Jewish Family Services to start to do some advanced care planning work in diverse communities with newcomers to Ottawa, and that work was going very well. And we reach out to the general public. We use social media, we use traditional media wherever we can, and we have a website that we work, to keep as nimble as we can to respond to what's going on. So what's going well? Interest was growing in our community. People are getting engaged. They're interested. We've had a couple of public workshops. They've been well subscribed. We get excellent feedback on the workshops. We've been consistently increasing our community partnerships. So we have lots of people around our table now, and we meet with them regularly, communicate with them regularly, so our relationships are going well. And in terms of the improvements we've achieved, we have a fulsome evaluation program that was developed in partnership with the University of Ottawa, and we evaluate our workshops and to date, we're very happy that the majority of people that attend our workshops have started a conversation about values, wishes, and beliefs. The majority of them have identified their substitute decision maker, and the majority of them have had a conversation with that person. So COVID-19 has impacted our work immensely. Our work has been very much face-to-face in the community. And now in this new environment, we've had to change that. And so we knew there were two important things we needed to do in this new environment. And that was to keep our volunteers engaged and our facilitators engaged, because if volunteers aren't participating in a meaningful manner, we know that we'll lose them. And the second thing was to continue to support our community. And so we immediately got, messed with Nadine and Tara, and she works with at the Champlain Hospice Palliative Care Program, and developed a couple of Zoom workshops that we could do with our volunteers and our volunteer facilitators. One was on conducting an advanced care planning workshop in the community. And that Zoom workshop demonstrated to us that this is actually something that could work. And so as a result of that, we're meeting again to try and decide how would that look if we were going to offer this to our community partners and to the general public. How would we do it? And, what kinds of things do we need to think about? The other thing, I should step back and say that Compassionate Ottawa developed a rapid response team immediately when the COVID shutdown happened to look at all aspects of our work, not just our advanced care planning work, but all aspects. And one of the first things we did, we knew there was a lot of talk in the media about you have to talk about this, you have to talk about this, you have to talk about your wishes for future care, but nobody was saying, how do you do that and what does that mean? So we immediately wrote an op-ed piece that was published in our two local papers, The Citizen and Le Droit, that basically said how you do this, what the steps of advanced care planning are. And we're in the process of developing other op-ed pieces on other important topics like caregiving in the community and loss and grief. The other workshop we did that Tara did for us, for our volunteers, was a workshop on loss and grief. And it's become very apparent to us that our community is grieving many, many things, as all of your communities are. And as a result of that workshop, we've developed a team of people in Compassionate Ottawa who will focus solely and primarily on loss and grief and see what kind of outreach we can do to the community. Again, we're very lucky. We have volunteers at Compassionate Ottawa who are quite skilled and experienced in loss and grief, and they'll work with Tara and Nadine to do that. And then some of the other work we've done is we've developed a Facebook private group for our volunteers so that we can communicate frequently. And our staff were excellent at getting everybody up to speed on Facebook, developing some great videos that help people set their privacy settings, because some people are worried about that, help them navigate Facebook. We're also working on our website to make it more nimble, more flexible, so that when people from the community come, they can quickly get to resources on, for example, advanced care planning that tells them how to have the conversation. So to close up, what are the three most important things that I advise other people who are doing community-based work to consider? The first thing I think is that while it feels like we need to do this work very quickly, it's important to take your time and work carefully. Sometimes we feel, we know the needs in the community are so great right now, but we need to do this right, and we need to support our communities. Secondly, we need to keep our community partnerships going and to strengthen them. And finally, we need to be flexible, we need to be nimble so we can respond as the needs come forward. So I look forward to our conversation, our chats as we go on this afternoon, and thanks so much.
And I would now like if Elizabeth could jump in and just provide us a brief introduction and let us know where you are on the continuum and just a brief background, because we're going to have a more fulsome discussion
after that.
Thank you, Claire, and thank you, Louise. I'm Elizabeth Bedard-Huber, and I work with the BC Centre for Palliative Care with the Serious Illness Conversation Initiative. And our focus on that continuum is really with the patient or the person who is now facing a serious illness. And so when we think about a serious illness, we needed to define it. And we looked at the work of Dr. Amy Kelly and her colleagues, who defined it as a condition that carries a high risk of death over the course of a year, has a strong negative impact on quality of life and functioning in life roles, is highly burdensome to a person and her family. We then thought about, well, what is a serious illness conversation? And we have adopted the work that Ariadne Labs has done. They're affiliated with Harvard Medical School. And we recognize that a serious illness conversation is a clinician-initiated conversation, and it's a listening conversation that happens early before a crisis or serious decline, focusing on the person's priorities, and it is revisited over time. What it is not a conversation that is based on making medical decisions or code status or discussion around medical assistance in dying. And what it can do, however, is to lay the foundation for future discussions that might have to discuss future healthcare plans. So what we found from the work done in Canada, as was discussed earlier in this conversation, many people are thinking about advanced care planning, but very few are actually having discussions with their healthcare providers. And what we found is that people are actually waiting for their clinicians or their physicians to start that conversation. And so we felt that we wanted to see these conversations happening earlier in the disease trajectory, not towards the end. And we felt that we needed to support healthcare providers, not just the palliative care clinicians, but everyone, to have these types of conversations so that they feel more confident in using them. And where it fits in that continuum of advanced care planning, it fits kind of in the middle. This is our schema that we use in British Columbia. And you can see that the serious illness is the third box from the left on the screen. And what we have been using as one of the triggers is the serious illness, or the surprise question. Would you be surprised if this person was to die within the year? And if the answer that the clinician gets is no, I would not be surprised, then the thinking is that this patient would benefit from a serious illness conversation. And then you can see on our schema here that that lays the foundation for, as I mentioned earlier, for the future conversations. And at the end, just assessing whether or not the care that the patient has received is in alignment with what they've discussed as their goals, wishes, and preferences. So, So to do this, we looked to a journey map that Ariadne had developed, and we took a provincial lens to see how we could influence the implementation of the program, the Serious Illness Conversation program, and also the use of the guide throughout the province. And you can see here on the slide that there are 4 phases. Hi, Claire. Let's switch over to Nadine while we try and get Elizabeth back on the phone.
Great.
Nadine, we're whipping across the country right over to you.
So, hi, my name is Nadine Bulk. I am with the Champlain Hospice Palliative Care Program. We're a regional program in Eastern Ontario, and our role is to help lead and coordinate and support hospice palliative care in the region. Our purpose statement is to engage people in palliative care so that they are seen, supported, and connected. And so that means we work with everybody who's connected to hospice palliative care, volunteers, caregivers, patients, healthcare providers in all settings. And our key areas of focus are increasing equitable access to hospice palliative care, in helping to build capacity, and increasing engagement and awareness. So advanced care planning really for us fits into all of those buckets. We started by doing some advanced care planning presentations for the general public and realized there was a real appetite to actually practice having some of these conversations. So we developed some workshops. And from our workshops, we learned a few other things. One is that there's a huge appetite for people to have opportunities to come together and talk about advanced care planning, wishes, values, and beliefs. We also learned that there's no way that we can meet this demand on our own. We're a very small group. And so we started training volunteers, recruiting and training volunteers across the region. We worked very closely with, as Louise has said, with Compassionate Ottawa, so that we have more people who can do advanced care planning workshops. And we've also just recently worked with Hospice Palliative Care Ontario and Waterloo Wellington to develop a provincial training package for volunteers so that there's some standardization in the province for doing advanced care planning workshops. We also learned in our initial workshops that, or we noticed that half of our attendees were usually healthcare providers. So we started customizing our workshops so that we could work more specifically with a healthcare provider audience to talk about their role in advanced care planning and goals of care conversation. So we developed what you could call essentially a lunch and learn or goals of care 101 that we deliver in the region, often in partnership with the regional palliative consultation team. And then we also encourage people to take advantage of the Hospice Palliative Care Ontario e-learning modules on patient-centered care. Those are excellent if you're in Ontario and really want to understand the healthcare consent framework. And then we're just starting to explore using the serious illness conversation guide training and incorporating that into our educational offerings. We're working with a few other partners on what we hope to do this year. We'll see how we deliver it, but some early identification quality improvement days that would incorporate serious illness conversation guide training. So it's kind of an overview of some of our work in advanced care planning. So we try and offer a little bit of everything for the general public, but also more specifically for healthcare providers.
Thank you, Nadine, for that. I believe that we are trying to reconnect Elizabeth, but I'm just wondering if anybody has any questions for our presenters today. If you could go ahead and type those questions into the chat box, that would be great, and then we can make sure that we're able to respond to them and ensure that we are able to post resources as well later. So thank you for the introduction. It's great to see the different approaches across the country. I'm just wondering though, in what ways has COVID-19 impacted the work that you're doing? And I'll go to Elizabeth, are you on the line now?
Yes, I am.
So Elizabeth, if you could speak to that, and then I'll have Nadine jump in.
Okay. So sorry, I guess that my line got dropped, but what we're doing now is we had in British Columbia, we have a training program for the Serious Illness Conversation Guide, whereby we
worked to develop different education platforms, and we have a full-day workshop, we have 3-hour workshops, an online module, and we have, when we implemented those works, we found that some adaptations needed to happen, and they have happened in British Columbia with adapting the guide for substitute decision makers for the pediatric patient population. And also more recently, we partnered with First Nations Health Authority and looked at the language through a cultural lens. And you ask how COVID has impacted our work here in British Columbia. And we found that to meet that need, what we have just recently done is we've developed a 1-hour Zoom just-in-time education that is designed to be kind of like a quick and dirty, so to speak, to get this, to help people feel more confident in having these types of conversations. And so that's how we have responded. And we're just rolling that out now slowly and working through all the glitches, with Zoom. But it's so far so good.
Thank you for that, Elizabeth. And Nadine, if I could have you jump in. So like everybody else, we're scrambling a little bit to try and take everything that we do, usually face-to-face, and put it online. And as we've even experienced today, there are always hiccups with that. So with COVID-19, the impact specifically is in moving things online. We've recognized the importance of having technical support and somebody who can work with the users on the other end, a lot of whom aren't necessarily comfortable with some of the technology, so that this is accessible for everybody. But another really important thing for us is in moving things online. I think part of the richness of the workshop and getting people together is that it helps dispel some of the myths that these conversations somehow take away hope, and that when we can get together and open things up, we can help people reframe and put the focus on, not on death, but on quality of life and what's important to us. And that makes it a little easier to enter into the conversation. And by trying to do that, though, virtually, adds an extra challenge in how do you build that connection. But also, when we're working virtually, we have to be really mindful of the importance of creating safe space from a distance, to have our backups and follow-up plans in place so that if we notice somebody's struggling, that there's somebody whose job it is to follow up with them. So really having to kind of look at everything that we get out of our face-to-face workshop and putting that in a virtual realm.
Thank you, Nadine. And I think it's that virtual, establishing connection virtually is so, can be so challenging. I think we've had a few glitches here today, just with technology and especially when we're discussing these things. And Louise, I'm wondering as well, you spoke at length about the programming that you're doing in the Reach Out, and I'm just wondering if you can just briefly speak to, briefly reiterate some of the lessons that you learned with COVID there.
Sure. Thanks so much, Claire. Can you hear me okay? Yeah, great. Yeah, I think Nadine pointed out a very important issue that has come up at both of the virtual workshops we've done so far, and that is supporting people in real time during these workshops. We know when we're out in the community, there's almost always circumstances where, people, it triggers something for people. People become distressed having conversations, And so we're there to support them. Other people are there to support them. So we need to learn how to do that virtually. So, we obviously don't want to do more harm than good in our community. We need to figure out how to do that. And I must say, I noticed in the chat box, people earlier were talking about how it's important that advanced care planning isn't all about end of life. It's about living well, and that's absolutely right. And that's the focus we take in our workshops. But COVID has raised some issues for people, right, that relate to serious decisions and relate to end of life. So, we're sort of struggling with how do we bring those two things together so that we can, so that it's useful, and yet we still get people to focus on living well for as long as they can. So I think that's, and also all of the facilitators have trepidation about working in this environment. So, we're taking it one step at a time.
Thank you. Thank you. I know that we have a few more questions. There's been just some excellent questions coming up in the chat box here, and it strikes me that we are in this new reality, and I think that COVID has provided lots of different opportunities, and I'm just wondering how is, I see that there's a question about how role-playing is working online, and I think that's a really pertinent question. So I'm wondering if Nadine or Louise or Elizabeth can talk to that.
We haven't, I don't know if is my mic open? Okay. We haven't done role-playing in our workshop. We use a game called Go Wish oftentimes to prompt conversation. And so a lot of our learning has been around, again, how to take that online and use the small breakout rooms on Zoom and facilitate those conversations there. I think BC Centre for Palliative Care has done some role-playing, or at least that's what it looks like maybe in the chat boxes.
Great, thank you. I'm just aware of the time, but what I would like to do is to think about the three most important things as others are looking to implement the programming. What are the three most important things that you would advise others to consider? And Louise, if you could respond to that.
Thanks, Claire. I think I mentioned them when I spoke earlier, that that while we feel we need to go quickly, we need to take our time, we need to be flexible, and we need to keep working in partnership. That's what we've learned so far.
Thank you, Louise. And Nadine, what would your advice be?
Some similar things to Louise. I think for us, we found it's all about the relationship, that we can't move this forward without meaningful partnerships and connection. And this also helps us focus on delivering programs and support with little or no money. And it allows us to extend the scope of what we can deliver. So I would encourage everybody not to let funding be a barrier. There are all kinds of creative things that you can do in partnership for little or no cost. We've learned the importance of trying to make this as easy as possible. So I mentioned online making sure that people can easily access it. For healthcare providers, our work there is around trying to leverage activities and initiatives that are already happening. So this can be incorporated into people's workflow. So there's not just one more thing that people have to add to their to-do list. So it needs to be as easy as possible to integrate. And I think the last thing that I would stress is now more than ever, it's important to use a trauma-informed approach, whether it's virtually or at the bedside. There is a lot of grief and suffering right now, and these are difficult conversations oftentimes for people anyhow, and there's a whole other layer of emotion right now, and we need to be really, really mindful of that so that we can help people engage in advanced care planning in a way that feels safe and comfortable.
Thank you, Nadine. I think that's the issue of safety is so very important. And Elizabeth, I'm just wondering what 3 top tips you would give to others seeking to implement programming.
Thank you. I think that I would agree that developing those partnerships is really important. And in our role at the BC Centre for Palliative Care, we influence the implementation of the Serious Illness Conversation Guide and also the COVID Conversation Guide. And so working within partnerships, but also being able to adjust to meet the needs of the various partners that we're working with and to be flexible with that. Just also, we have tried the role play. We feel it's really, really important to try role play, and we've used the Zoom breakout rooms effectively, but they do take a little bit of coordinating and organizing. So we have had success with that, working in rural remote across the province. So that's been very, very helpful. So I guess that's basically, everything else that I would say has been said, and I totally agree with the other speakers on the webinar today. Thank you.
Thank you. That's great. I just have one last question that really struck me in the chat box, and wondering about how does poverty, lack of assets, and just lack of other resources and support, how does that impact the conversations that individuals have? And I'll go around in the same cycle again, Nadine, if you could respond to that.
So we've done some work with Ottawa Inner City Health and Ottawa Senior Pride. And both are groups that I think have had some unique challenges, and this is connected to me to what you were just asking about. So with Ottawa Inner City Pride and also some work that we've done in retirement homes, we realized that as we're having the conversation about identifying your substitute decision maker, that we were making a whole lot of assumptions about everybody having a substitute decision maker, and sadly there are a lot of people who feel that they don't have somebody that they could ask to play that role. So with Ottawa Senior Pride, working with that community and that group to try and see how they could provide that support for one another. With the vulnerably housed, we did a series of workshops, including around advanced care planning, and we're still having some of those conversations to try and support them to have advanced care planning conversations, identify a substitute decision maker. But there are a whole host of challenges with, maybe having a substitute decision maker that has capacity one day and maybe the next day doesn't. Or where do you keep any paperwork if you have a power of attorney for personal care, but you're vulnerably housed and you're estranged from your family, so you don't feel you can call on them. So all of those kinds of issues take something that's already quite difficult for a lot of people and just add a whole other layer of complexity. So I don't know that we have an answer for you, but we're trying.
And I'm wondering as well, I'm assuming that you've got some resources that we could share with the participants today as well, just around raising awareness of that. I think those are often things that we don't necessarily think about as healthcare professionals when we're interacting, especially in more of a clinic setting. So thank you for raising awareness of that. I am aware of the time. I'm just I know that we will be making resources available, but I will hand over now to Jennifer Zellner.
Thanks, Claire. And we probably have time for one more person to come in on the last question that Claire asked. So Elizabeth, I wonder if you have 2 cents that you want to add to the conversation from your experiences out west in terms of reaching different kinds of communities with these conversations.
Yes, I would like to speak to that. What we did is we partnered with First Nations Health Authority, and through a cultural lens, we looked at the use of the Serious Illness Conversation Guide within the First Nations communities. And over the last couple of years, we found that we needed to adjust the guide. And the main things were to really embrace family, to be present in the preparation prior to having the conversation, to ensure that the right people are present when we actually have a serious illness conversation, whether it's around a serious illness or a COVID specific. Asking permission to have the conversation, very important, not just at the beginning, but all the way through, checking in all the time. Having the language is a little bit more direct and plainer, and we incorporated a dignity question. What do I need to know about you as a person to give you the best care possible? So those were some of the changes that we adapted with our partners with First Nations Health Authority. And now what we're doing is we're looking whether or not that would be suitable for other populations throughout British Columbia. Thanks,
Great.
Claire.
Thanks so much. Thank you so much.
Jennifer.
And thank you all around. In fact, that's where I was going to go next, because I know if we were in a big theater right now, I would be saying thank you, and there would be thunderous applause. So here is our virtual equivalent of thunderous applause. I've really benefited from today's conversation, and I know from reading the comments in the chat that many people have as well. And special thank you to those who jumped in and answered colleagues' conversations in the chat and provided some additional resources as we went by as well. You'll see on the screen some resources that our participants today and others have suggested as useful next steps if you wanted to continue this conversation, because it's obviously not just a conversation for an hour or a day, it's a conversation that we're continuing over time. And, I've really appreciated the insights that each of you shared. Claire, you started us off with reminding us why we're talking about this conversation, both in general and now, in terms of why we're having this conversation and framing it in terms of that continuum. And Louise, you then jumped in to talk about how you've been having those conversations and having them, now in new ways compared to ways that you might have been having them previously, and so much for us to learn on that front. And Elizabeth, we whizzed across the country to you, all the way to the West Coast, and the insights that you had to share and the different experiences and communities that you've been working with, and how you too are shifting into the world that we're in, and responsibly recognizing that we need to have some of these conversations in different ways right now. And I know you're looking to see, the responses to the Zoom service that you're providing and other things, and it'll be great to learn from that on an ongoing basis, because I think so many of us now are trying new things. So it's that opportunity to really try and learn and ask ourselves, what worked well and even better if. And I appreciated your reflections on that as well, Nadine, to be able to say, here's some of the things that are working for us. Here's some of the places where we're still learning, so that hopefully we can continue that conversation together as well. So huge thank you to all of our panelists today. and also to everyone on the line for being part of this community conversation, and hope to see you on the next Spotlight webinar call. Thank you so much. Merci beaucoup.